And I think, I actually reread my book this morning, and initially they were saying that the fatality rate was 7%.
Mm.
And then I think Jay Bhattacharya was saying it was less than 1% at the time.
Yeah, and also John Ideas. Well, we actually we were one of the first. I think we might have been the first to actually have a peer-reviewed paper published on the infection rates and the infection fatality rates, right? And what we did there was what we reported was indeed exactly what you've just said, that the infection rate, i.e. the number of people who likely had this virus, was at the time much higher than was being reported in that sort of spring of 2020. Whereas the infection fatality rate, that's the probability that you're going to die if you are infected with it, was far lower. It was much lower. We got that by just looking at the publicly available data from all of the different sources that you could at the time. And we applied our kind of like a Bayesian analysis to that. And yeah, and in fact, the data that the results that we came out with were consistent with what people like John Ioannidis, and Jay Bhattacharya. In fact, we were probably we were actually estimating even lower rates. And of course, even then, it was clear that the risk of death of anybody really above the age of sort of 80 was incredibly low.
Thanks for watching the Radical Health Rebel YouTube channel. If you enjoyed this video, please be sure to share with your friends and family, or share via your social media. Hit the like button, subscribe to the channel, and hit the bell icon to receive notifications of new video clips from the podcast. And if you want to watch the full episode, completely ad-free, plus premium content, and join the Radical Health Rebel Patreon community, head on over to the Radical Health Rebel Patreon channel at www.patreon.com/Radical Health Rebel. Thanks again for watching.